How do you know if your UTI is a kidney infection? Imagine feeling a burning sensation when you urinate or noticing cloudy, foul-smelling urine. These are common signs of a urinary tract infection, or UTI, which usually starts in the bladder. Most UTIs cause symptoms like pain or burning during urination, a frequent urge to go even when the bladder isn't full, blood in the urine, and mild discomfort in the lower abdomen or pelvic area. These symptoms are localized to the lower urinary tract and often improve with treatment. But sometimes, a UTI can become more serious if it spreads up to the kidneys. This is called a kidney infection or pyelonephritis. Recognizing the difference is important because kidney infections need prompt medical attention. If you have a simple bladder infection, you might experience the typical symptoms I just described. However, if your infection has reached your kidneys, you will often develop a high fever, usually over 101 degrees Fahrenheit, and chills. You might also notice pain in your lower back or side, often on one side, which is known as flank pain. Nausea and vomiting can also occur, along with feeling extremely tired or weak. Some people lose their appetite, and in some cases, diarrhea may be present. While symptoms like painful urination, frequent urination, and blood in the urine can happen with both bladder and kidney infections, the presence of systemic symptoms such as fever, back pain, nausea, and vomiting strongly suggests the infection has traveled to the kidneys. These signs indicate that the infection is more severe and requires urgent medical care. Understanding these differences is especially important for maintaining bladder health and being aware of bladder cancer risks. If you ignore symptoms or delay treatment, the infection can worsen and lead to complications like kidney damage or bloodstream infection. For individuals with a history of bladder cancer or other bladder conditions, quick recognition and treatment of UTIs are crucial to avoid worsening their health. If you suspect you have a UTI, it's essential to see a healthcare provider for proper diagnosis and treatment. They will likely perform a urine test to identify the infection. For a simple bladder infection, a short course of antibiotics is usually enough. But if it's a kidney infection, stronger antibiotics are often needed, sometimes given intravenously in a hospital, especially if symptoms are severe. Preventing UTIs involves good bladder habits. Drinking plenty of water, urinating regularly, and practicing good hygiene can help reduce your risk. If you have a history of bladder issues or bladder cancer, regular checkups with your healthcare provider are important to monitor for infections and other concerns. Remember, most UTIs are manageable, but recognizing when an infection has reached your kidneys is key. If you experience fever, back pain, nausea, or vomiting along with urinary symptoms, seek medical help immediately. Early treatment can prevent serious complications and protect your kidney health. Always consult a healthcare professional for personalized advice. This information aims to help you understand your symptoms and encourage timely medical care, but it's not a substitute for professional diagnosis and treatment.